Hello, everyone. My name is Ali Aminian, bariatric surgeon at the Cleveland Clinic. On behalf of the IFSO, I'm inviting you to join us on the 12th IFSO Journal Club, which will be held on June 19th. And the title of the study, which was chosen for this journal club, is Prevalence and Risk Factors for Chronic Abdominal Pain After 1Y Gastric Bypass Surgery, which was recently published in Annals of Surgery. The study comes from Department of Surgery at the Zealand University Hospital from Denmark. The senior author is Fredrik Herkstrand, and the first author is Dr Gormsen. And I'm happy that we have Joanne with us today here, and we're going to do a brief interview with her to know more about this important study in our field. Hi, Joanne.
Hello.
I'd like to congratulate you on doing this important study, and I'm going to ask you a couple of questions about the importance of a study.
Yes.
Very good. So, can you tell us about the importance of this study and why did you decide to do this project?
Well, first of all, in our outpatient clinic, we had a lot of patients with chronic abdominal pain with no explanation. We did ultrasounds, CT scans, MR scans, gastroscopies, everything, diagnostic laparoscopies, with no findings. And it was kind of frustrating, and we wanted to put kind of a focus on this group of patients. Yes, and that's why we did the study.
Okay. And did the finding of the study surprise you?
Well, not really. It is like we experience a lot of these patients, and a lot of them, yeah, they take up a lot of space in the surgical department. So actually, we expected maybe more of the patients to have pain than we actually found, but the results were not really that surprising now.
Okay, so you found that about 10% of patients years after gastric bypass experience chronic abdominal pain, 1 out of 10 patients, which seems quite high, but might be surprising for some, but I think according to the literature, so that's very reasonable number, right? It was reproducible in other publications too.
Yeah, and it seems to be the same amount of patients who have chronic pain after cholecystectomies or herniatomies. So that way it seems kind of reasonable.
Okay.
And also, like in other studies researching gastric bypass patients.
Okay. And but the point is that we don't know the cause of that pain, right? In this population, it might be the anatomical factors like gallstone related or marginal ulceration or hernia or adhesions, which could be fixable problem, but it could be idiopathic chronic pain without any reason. But this study could not differentiate between these type of problems, right?
Well, no, not really, but we believe that most of these patients have been through a lot of diagnostic measures, like they have been through ultrasounds in order to test for gallstones, and they've been through gastroscopies to test for marginal ulcerations, and we've done CT scans to test for internal herniation, and a lot of them have been through diagnostic laparoscopies where we also done some adhesiolysis. So I think that most of these patients have something that we cannot that easily just fix. Like 5 years after surgery, if they still have pain, then I believe that it's a problem that we can't really fix surgically.
Okay. Very good. So you believe that most of those patients had non anatomical cause. I mean, at least we don't know what the cause was in most of those
Yeah,
patients.
maybe there is some kind of anatomical cause, but yeah, we've talked a lot about different causes for abdominal pain. Um, yeah, but we haven't really come to anything like conclusive.
Okay. And interestingly, the study found some risk factors for development of chronic pain after surgery, and some of those risk factors would be modifiable risk factors like the smoking. Can you tell us
Yes.
about those risk factors briefly?
Yeah. First of all, we found that patients who use opioids or strong analgesics prior to surgery, they have a higher risk for development of chronic abdominal pain afterwards. And in Denmark, we have now a policy that we don't operate on patients who already have chronic pain elsewhere. So if they take some kind of strong analgesics due to what can you say, arthrosis, then we try to make them stop taking the analgesics prior to surgery. And actually, we don't really operate on patients who smoke anymore, but yeah, we've actually done a different study where we've tested patients for smoking prior to surgery and found out that a lot of the patients who say that they've quit smoking, they actually didn't quit smoking. So it's a little bit hard to, in reality, to take that out of the picture.
Yeah, that's very important to identify the risk factors, and hopefully if we can modify those risk factors to decrease the risk of complications, the pain complication, which is not tolerable in many patients. Okay, yeah. I think we can stop here. Those answers are very helpful, and I invite everyone to join us on June 19, which would be about 2 weeks from now, to hear more about this important study. And we're going to have question and answer, so you can ask your questions directly from the first author of the study, and Joanne going to answer you. Thank you, everyone, and hope to see you all in 2 weeks. Have a good day.